Thank you for visiting Medicare on Video. I'm Keith Armbrecht, founder of Medicare on Video, and I help people across the country make the right Medicare choices. And the best part about what I do, doesn't cost you anything to allow me to help you. So I certainly hope you take advantage of everything that I offer, and we make sure that we get all your pieces put in the right places. Right now, I'm going to talk about original Medicare. So we're going to give an overview basically just on how Medicare functions. I'm going to try and get this done in under 3 minutes. And if you have any questions at the end of the video, feel free to give me a call, send me an email. I'm happy to help with anything involving your Medicare. So let's get into it and see how we can do. So original Medicare, when you come in, is made up of 4 different parts. You have Part A, Part B, Part C, and Part D. And I don't know why they take everything and put it into pieces and typically make it much more complicated than it really needs to be. It's very similar to likely what you have currently, your basic health insurance. They just break it up into different pieces. So let's kind of get through the parts of Medicare and how much they cost and what your out-of-pocket expenses will be. So Part A, which is what covers things that happen in the hospital, has no premium. So as long as you've worked for 40 quarters or 10 years during your lifetime, you have no premium for Medicare Part A. Medicare Part A does have an annual deductible between January and January of each year, and that's $1,408, and that is per benefit period. I have some more detailed information on each of these parts in different videos, so feel free to take a look at those. And then co-insurance for day 61 plus in the hospital. So the first 60 days in the hospital, no co-insurance. After 61 days, there is a daily fee for being in the hospital. So again, you must have worked for 10 years or 40 quarters to have no premium for your Part A. Now, Medicare Part B is what happens outside the hospital, your doctor visit, your special visit, your outpatient surgery. And it does have a premium, and it runs right now at $144.60 a month. That is the base premium. The majority of people will pay that, but it is income-based. So if you have higher income, you likely will pay more for your Medicare Part B. Medicare Part B also has a deductible. And again, this is stuff outside of the hospital. So you're responsible for the first $198 each year. And then after that, that satisfies your deductible. Once you've met your deductible, Medicare is going to pay 80%. You're going to be responsible for 20%. So you can see Part A has a pretty big deductible of $1,400. Part B has a small deductible of $144. And then there's 80/20 co-insurance. There are plans that are called Medicare supplements that will cover those costs. So in other words, you'll likely have that as well. And we're going to get into that just a little bit. Medicare Part C really refers to a Medicare Advantage plan. So that's a completely different part of Medicare. When you come in, you really have a choice of either staying with original Medicare or going on a Medicare Advantage plan. If you stay with original Medicare, you'll likely have a Medicare supplement plan that covers those pieces that Medicare does not. So your Medicare supplement plan generally has a premium anywhere from $50 to $200. Just depends on where you are and which plan we choose. And again, that's what I do, is I help with that. So feel free to give me a call or send me an email, and I will make sure that we get you the best value. Medicare Advantage plans, again, they're network-based plans. They have lower premiums, but they can also have lesser benefits. So it can cost you more out of pocket to use them when you go. But certainly something to understand and something that we can help make sure you get the right information. So Medicare Part D, the last piece, is a drug plan, and the premiums on drug plans are absolutely variable. This might be one of the more complicated parts of Medicare, is making sure you get the right drug plan. It's based on your current medications and how much of a deductible you might be wanting to have in order to lower your premium. It can have a deductible as much as $435 for the year. So again, this is all stuff that I help with and make sure that we get everything done in the proper fashion, all your pieces in the right places, and that you're comfortable with exactly what you have with Medicare. And what I can tell you with Medicare is it's terrific. And as long as we put it together correctly, it's likely going to be the best health insurance you've had your entire life. So we just want to make sure we get all the choices correct and then put everything in the right place. Feel free to give me a call, send me an email, or visit Medicare on Video, and you can put in your information right there. We can get you quotes on Medicare supplement plans. Super easy to do. So I'm happy to help. I hope you found this helpful. Have a fantastic day.